Caught me by surprise. Good morning, good afternoon, good evening, wherever you are in the world. It is Dr. Jan Fortman with Relationship Matters TV. I hope everyone is having a beautiful, beautiful, blessed morning, afternoon, or evening. It's I'm looking outside, I'm looking out the window, and the weather here in Chicago. Well, it was nice this morning. Then it started raining, and I think, about maybe 50 degrees. Tomorrow it's supposed to be almost 80, sunny, beautiful. Saturday, back down to 50. Sunday, Easter Sunday, when people like to go to church, dress up, Easter egg hunt, whatever, it's going to be raining all day. However, we're just very happy that we're here in Chicago anyway. Anyway, um, I don't have a soapbox to get on today. And so what I'm going to do is just bring my guest in. So let me tell you about my guest today. This is someone that I have been knowing for quite some time. As a matter of fact, he used to be my doctor. He was my doctor. Then he was my mother's doctor. And then for, a little bit, just to see my grandmother's doctor. And then my son's doctor. And so one day, when I was in the office, he said he was retiring. He did not ask for my permission. And I didn't give him my permission, but he did it anyway. However, I forgive him now. 30 years later. So let me tell you about Dr. Forrest Jones. Let me tell you about it. Dr. Forrest Jones is a family physician with more than 40 years of experience. He received his medical degree from Northwestern University's Feinberg School of Medicine and completed his family medicine residency at Cook County Hospital in Chicago. So anyone who's in Chicago knows all about the Cook County Hospital. Over the years, he has cared for many older adults, including my mom. This, with his experience as the medical power of attorney for his own parents, gave him an appreciation and concern for what family caregivers go through. So this led to his focus on helping caregivers. And I know a lot of you out there are caregivers, have been caregivers, will be caregivers, or know someone who is a caregiver. So he helps spouses, the children, friends, and neighbors who give their time and energy to care for an adult family member or a friend. Now, he also has something that we're going to talk about. It's called Caring End. At Caring End, they believe in empowering family caregivers with knowledge, compassion, and support, which is so needed. They help you find peace of mind during chaos. I know about that. Clarity when you're confused, and confidence when you're faced with hard choices. Now, what does he do when he's not doing all of this? He enjoys spending time with his wife, Roberta, his partner for more than 45 years, as well as their children and grandchildren. And I also know that he likes to travel. So I am going to bring to you Dr. Forrest Jones. Hello, Dr. Forrest Jones.
You're so kind. You know, your forgiveness means a lot to me from the relationship doctor. So I'm glad I finally earned it.
Finally, but it took me a long
Finally.
time to forgive you. I thought, I don't believe this. What? And you were so young, and I'm like, why are you retiring now? So anyway,
It was time.
yeah, yeah. You moved
Sure.
on to bigger and better things. And the thing is, I really love what you're doing because you were my mother's doctor. And well, we could talk about that because Miss, some of you out there know of Miss Travis or knew Miss Travis, my mama.
She made sure I was doing the right thing.
She sure
She
did.
let me know if I was if I could
She
improve.
wait, and just a little story before we get started. When she had to see this other doctor, and I forgot her name now, but she told her, she said, well, I'm just going to peek in just to see how you're doing. And my mother said, peek in, you're all the way in. You need to use the correct words. Just
That's
tell
true. I
me
forgot that. That's true.
you're all the way in. I'm like,
Yeah, she was
this
special.
her?
Yes.
So, Dr. Jones, so
Hmm.
you were in primary care and you were a family doctor. So,
Yes.
what made you well before you started really maintaining or just kind of focusing on older adults? What did you do right before then? Because I think you were doing some kind of research or something.
Well, I did my, as you mentioned before, I did my medical school at Northwestern,
Mm-hmm.
and then Cook County, I did my residency in family medicine.
Mm-hmm.
So family medicine is really um, an updating of general medicine, general practitioner, and with the particular focus of intentionally taking that general approach and applying it to the family setting, recognizing that when I'm seeing someone in the office, it's not just one person. I'm really seeing a representative of a family. They have a context. They have people that they are accountable to and who are accountable to them, and people who are in their world. And we want to not only be aware of that, but be able to respect that and also leverage that when we need support from the family to help us provide the care that we want to provide, which rolls right into what we're talking about today. Because so often I would see the family caregiver, typically the daughter, but sometimes a son, sometimes a grandchild,
Mm-hmm.
sometimes a neighbor who lived next door for 30 years, who would step in and just be generous with their time and resources. And I'd look at what they were going through as they tried to do a good job that they really took seriously. And it's often a thankless job. And I would try to encourage them. But
Hey, yeah, go
let me
ahead.
add, let me add, because in family practice, in training, we learned how to do everything. I was delivering babies, pediatrics, and geriatrics. I gave up obstetrics and delivering babies because I just was not doing enough to really feel competent. And I was
Okay.
really afraid that there would be a period when someone would have a birthing emergency and I just would not be prepared. So I let that go. And eventually I was seeing more seniors and fewer children. And I decided, I really enjoy taking care of seniors. So I'm going to focus there.
Okay. All
Hmm.
right. So, what made you enjoy, working with seniors more so than, just younger people or,
I feel comfortable with seniors. I
okay.
remember even back in high school, my mom volunteered with Meals on Wheels. I followed her around and help her and so forth. So
Mm-hmm.
that was one thing. Um, Both my parents were the type of people who treated everybody alike, and they showed just respect to seniors as well, particularly. And I always felt comfortable around seniors as well. So, and I would learn a lot, see good examples that I would want to emulate and so forth. Yeah.
Okay. So now you focus more so on seniors. What do you, go ahead. Go
I
ahead.
was going to say, basically, I focus on caregivers of an
Care.
adult family member, because
Okay, so
I
mostly on
wanted
the
to
caregivers.
distinguish myself from caregivers of children and youth, because there's same types of pressures on, say, parents of children with cancer, disabilities, and so forth. I didn't feel equipped for that. That was not much of my experience, and so I'm going to leave that to someone else. But I just had a lot more experience with the seniors as well, and that was one reason why I decided to focus there.
So, what kind of the issues do you see as far as caregivers are concerned?
Good question. Um, One thing I do is, um, there's a concept called chronic disease trajectory, which is, if someone has a chronic illness today, there's a course that it tends to travel until that person's life ends. So that's called the trajectory. And basically, and this concept basically came out of the nursing profession, the nursing literature. Basically, they divide that into three types of chronic disease trajectories or chronic disease groups. One would be um, cancer type, where someone has some type of cancer, and depending on the cancer, it's going to have a particular path. Some cancers, for example, like pancreatic, you don't tend to be aware of it until it's pretty far advanced, and then when the diagnosis um, appears or you're aware of it, there's relatively short time, for example, less than 2 years. There are others that may take a lot longer, depending on whether they're diagnosed in early stage to later stage. And the caregiver tends to get involved when the person's health starts to fail. And with that type of, with the cancer type, the person tends to maintain a pretty normal or stable level of functioning and independence until they get toward the end where the cancer's advanced. And then there's a pretty stiff drop off of maybe a couple of years. For example, that might be once the chemotherapy fails, or
Mm.
once the cancer has progressed to the point that it's overwhelming the systems, then there's a pretty quick decline. So that's the pattern, the trajectory shape of the cancer type. Then there's a chronic organ failure type, which would be like heart failure, COPD, lung failure, um, kidney failure if someone does not go on dialysis, for example. They choose not to go on dialysis. So those are some examples of that. It could also be types of degenerative diseases that affect the nervous system, or things like that. Those types of trajectories for that kind of illness tends to form like spikes, where the person's in their level of independence and ability to take care of themselves will be at a certain level. And then as it gets advanced, they have to go into the hospital to kind of fix something. So, for example, if you have COPD, chronic obstructive pulmonary disease, and chronic bronchitis, they might be functioning for a while, then they might get pneumonia. They'd have to go into the hospital, get that treated, and then they're back on their feet. But over time, those illnesses tend to have a decline, which means that the person's going in the hospital more frequently. So it has that pattern of I'm doing okay, then there's a drop off, then I'm doing okay, then you have a new normal where it's continually climbing to the point where you've seen this, where someone seems to be in the hospital more often than they're out of the hospital. And at that stage, they really should be strongly considering hospice, because they've kind of reached the limits of what medical technology and knowledge is able to provide and medication is able to provide. And now we're focusing less on trying to cure it, because those treatments are not available anymore, but we want to try to make the best of what we have so the person can really try to enjoy and get value out of the time that they have left with family and friends and the type of things that would give them joy. The third type, which is actually the most common now, is frailty and dementia.
Yeah.
So, where you have basically a failure of uh, cognitive capacity, the person's ability to think manage their own affairs, and they become dependent on other people to take care of these things for them. That also would include frailty, where the person's musculoskeletal system is failing, you know, arthritis, joint pain, stiffness, lack of mobility, just aches and pains, and then loss of appetite, loss of energy, things like that as people age older and they have declines like that. That tends to be the longest lasting. That may be 10 years or more, you know, when as a caregiver, you're taking care of someone who is ailing in that way. So those are the three different categories,
Mm-hmm.
and they all have their own different approaches and so forth. So I hope that I answer your question.
Yeah. So, as far as the caregiver is
Hmm.
concerned, you says different approaches. Are there different approaches as far as the caregiver is concerned?
There are different demands and different requirements. So, for example, um, probably the most stressful and demanding for a caregiver is taking care of someone with frailty and dementia, because those people don't want to lose their independence, you know, and so
Okay.
that can, depending on their personalities and how they are actually trying to wrestle with how their life is changing, um, that can actually make it very challenging for the caregiver. Actually, when I approach the caregiver, I really look at it as kind of a three-legged approach. So the challenges that face caregivers, some of it has to do with just interacting with the doctors and the medical system. Another part has to do with interacting with the loved one who they're trying to care for. The
Okay.
third is interacting with themselves, which is a challenge because they tend to, especially as their responsibilities increase, they tend to neglect themselves, sometimes even feeling guilty if they try to address some of the needs that they have. And so I mention that here because for you caregivers out there, it's a way to kind of have three different buckets to kind of put your concerns. So it kind of helps you get around, get your head around the challenges because they can be so complex and demanding that it just seems like a huge cloud over your head, and you don't know where to start, where to end, and you're just kind of chasing your tail. And it can be very frustrating because you feel like you're not getting anything accomplished, and it can be very thankless as well. You don't feel like you're getting the appreciation for all the sacrifices that you're making.
So, Jacqueline Rogers asked a question. She said
Hmm.
she's still late, but does this include hospice?
Yes. And I'm glad you brought that up because when you talk about the trajectory from where your loved one's condition is today, and then you're projecting to the time when their life is ending, um, hospice definitely makes sense because um, there's a limit to what we can accomplish with medical technology, medications, and our knowledge. That doesn't mean that once we reach the limit of our technologies that we throw up our hands and walk away. Unfortunately, some doctors have done that where they say, "Well, I've done all I can do, and I'll see you later. Um, we don't need to have any more visits because there's nothing else I can do." And so, number one, hospice helps because you don't feel abandoned when you get to the end of where technology can really help. So that's one benefit. Another benefit is once you got to the end of where technology and medical knowledge can actually affect a cure, um, once you get to that point, you really don't want to be going through a lot of tests and technologies and procedures that really are not going to change the situation and actually can and not only introduce a physical risk because there may be over treatment, but then there's actual pain and suffering that goes with that. So if you are constantly going to the hospital, it's not going to really change the outcome, but you're getting blood drawn 5, 6 times a day. You can't sleep because there's all this noise and everything going around you. You're not in your own home. Your family can't be around you. Why am I even here? So
Yeah.
there, we are actually possibly introducing more pain and suffering unnecessarily. So those are some things to think about. Now, what can be complicated about that decision for hospice is when. When is it a good idea to focus exclusively on hospice? Um, and that can be very challenging because many caregivers and their families who are around them are afraid that choosing hospice means abandoning that person, when really it's just the opposite. It's just kind of acknowledging, okay, that treatment is no longer effective, so here's another treatment that we can use. And there's a lot of resources that come with hospice as well.
But
Um,
what, Dr. Jones,
yeah.
what happens? So, how do you support the caregiver when the person that they're caregiving does not want to go to hospice, does not want to
Yeah.
leave their home? How do you support them? I know I have friends right now
hmm
who, well, this one friend, her mom needs to go in hospice, but her mom is,
hmm
very independent. They,
hmm
and they're having a very difficult time.
Yeah.
So how do you support the caregiver? And then there's that other end when the person you're caregiving feels that you are, throwing them away or abandoning them or tossing them. How do you support them with that?
I'll actually add another scenario to that where the caregiver is doing all the day-to-day care, and they've been communicating with the doctor, and they've all come to the conclusion that, well, these treatments are really not going to help anymore. But there's the caregiver's sister or a brother who are across the country. They have not been in the day-to-day. They have not been talking to the doctors. They're the ones who are resisting. That's
Yes.
another scenario. And I would give another scenario where the the person being cared for is ready for hospice. They're tired. They don't want to go back in the hospital, but they try to soldier on because they know that my daughter, she's been doing care for me, and I don't want to let her down. So mama is still being mama. She's really looking out for that daughter, and I've seen that, and that can be challenging as well. I would say there's a couple of things to do there. One is, and this part has to do with partnering with the doctor. You really want to know from the doctor, what are the facts? Okay, what is going on? How do we get here? And that's where trajectory comes in too. Um, what is likely to happen going forward?
Okay.
So, if the doctor can actually break that down and explain that, that gives some very helpful information. And a nice context to doing that is in a family conference. I've done family conferences on the phone because sometimes you've got family members all around the country. They can't be there physically. When they can, we'll just do it there in the exam room or whatever. If not, we'll get on a conference call.
Okay.
And I would just give facts. I would just say, okay. Well, actually, I would start out saying, here's how I know your mom, dad, or something like that. And just kind of give some interesting tidbits about how we've enjoyed the visits and what I've learned about them. And I understand this is just not a clinical case. This is a real person who's in your
Yeah.
life, and you've got a history together. And I just want to kind of make the point to them that I'm fortunate to have shared some of that history with you, myself, and this is kind of how he's impacted me or she's impacted me. And then I would try to give my understanding of how we got to this point, and I will also ask others, do you agree with that, or did I miss anything, or do you have questions about how we got to this point? Because that's a big, uh, important part of trying to get on the same page as to where we are today. We have to have an agreement of where we are so that everybody's kind of has a realistic perspective.
Mm-hmm.
And so we'll talk about what the symptoms are that we're experiencing and
Mm-hmm.
what we've tried to do to remedy those things as best we can. And here's what we can expect going forward. Here's some test results
Mm-hmm.
that tell us something about this condition. And if it looks like this is not going to improve, I will give some of the test evidence. For example, if this was going to get better, your sodium would start looking like this, or your blood sugar would start looking like this, or some other thing. Maybe an imaging test would be different, but we're not seeing that. And we tried this to try to change that picture and get these test results more in line with health. And we have not been successful. And matter of fact, they're declining. And that's evidence that we've kind of reached the limit of what we're able to do. Or we've reached a point where is there a chance that the payoff is not there,
Okay.
where the symptoms and everything. So, for example, with cancer therapy, someone would say, well, you know what? It's not worth it. I mean, I'm throwing up. I can't, this and that. I can't sleep. And you're telling me that it's not going to make a difference. It's not going to help me get better. Um, I think I'll pass from now, and I'm just going to take a different treatment approach, which is focused on helping my symptoms be better.
Okay.
And that's what hospice is really about. So you want to first start with the doctor trying to get people on the same page.
That's
Then that,
the hard part.
yeah, but that's what's key because then that person who is saying, who's having trouble accepting this,
Yeah.
now we can have a conversation. Well, what specific part worries you? Or what else would you want to see? And what are you hoping for? Let's talk about that because that's important. And if you get that part resolved in terms of not only what am I hoping for, but what are the chances we can achieve that?
Yeah.
Do you need a second opinion?
Okay.
You know, what do you need to get us there? And then we can work with that. So now we're really working with the real issues
Mm-hmm.
that people need to cope with
Mm-hmm.
because once that person has passed, we don't want people having a lot of guilt,
Yeah.
regret,
Yeah.
arguing and infighting.
Yeah.
We want people to have an experience that is dignified. Their loved one has dignity. There's a legacy that the family can go on in a healthy manner. So these are some of the outcomes we want to achieve.
And Dr. Jones, I think it's wonderful what you're doing and you're focusing on because a lot of doctors don't go, into that. And
Hmm.
then you have, and I wish that you were doing that when my mom was going through this because I knew
Hmm.
that she needed, more help but people who were not with her all the time, like
Right.
I was, would say,
Hmm.
well, I don't see that.
Hmm.
She doesn't need this and she doesn't need that.
Mm.
And with her being a very independent woman, her thing was, no, I don't need
Right.
it.
Right.
But I knew that she did because I was there,
Yeah.
you know. And so when you're talking about that, having these family meetings and giving
Hmm.
them all of the information, then that person who is like, who's maybe in another state or whatever, can really see that, well, yes, this is coming from the family physician. I see all the tests. I see this. I see that. I didn't know.
Right.
And then get everybody on the same page. But a question came in.
Hmm.
It says, but first of all, here's a comment that I wanted to put here where Jacqueline Rogers says people don't want to let people live before.
Mm,
Very
that
deep, Jacqueline
that
Rogers.
is that's insightful, and I would like to add to that because I was mentioning about the role that the doctor can play. The doctor can provide information as part of this conversation and decision making. Now there's a part that the person being cared for and the caregiver and even other stakeholders, which might be other siblings, for example. Here's the question they have to ask. So, for example, for the one being cared for, what do you hope for? What do you think is going on? What are you hoping for? What do you most want to see? What are you most afraid of that could happen? Let's talk about that. And then the same questions go to the caregiver and any other important stakeholders because we kind of sit with those feelings. You may not even articulate them or even be consciously aware of them, but these are motivating our behavior and our decisions. So let's put those out on the table, bring them into the light of day, and then not only are we sharing this stuff, which actually adds to um, what does living really mean, and then we can also talk about, okay, why is that important, and how can we do things that can get us as close to that as possible. So this gets into the emotional space. So what we're talking about with the doctors is kind of like the physical issues,
Mhm.
but what impact is that really having, not only on me but those who are around me. So for example, someone, their biggest fear is not being able to play golf, not being able to travel, um, not being able to be around when my grandchild graduates,
Mhm.
And so we start hearing about those things and say, oh, now we can get our heads around that. It's not something that's just a source of confusion or frustration, but we can now start to come up with practical strategies.
Okay, all righty.
Hmm.
So this is the question that came in.
Hmm.
As a doctor, did you find it difficult for caregivers to understand their responsibilities?
Interesting. Generally, I would say the bigger challenge for caregivers is understanding or being able to manage the impact that is really having on them.
Mm.
Now, in some sense, there can be a number of ulterior motives in there that are kind of special cases. I don't know if it's special cases, but so for example, you got a caregiver, they want to keep mom or dad alive as long as possible because they want those social security benefits.
Yeah,
They want to keep all that stuff going because that's the only income in the house,
yeah.
you know. So you've got some ulterior motives, and frankly, we bring in case managers and social workers to help us with that because there are some steps that you need to take, documentation that you have because you really have to protect that loved one because they're in a situation where the person who's responsible for them is not really responsible to them. So that's kind of one way I read the question.
Okay.
Another way I read the question is the caregiver, um, as a result of that particular challenge, neglect themselves. And they may not appreciate how their well-being is a key factor in achieving and maintaining the well-being of the person they try to. I've actually gotten blunt for the person who's being cared for, and I will actually said this is the only person who's keeping the treatment plan going. If they were to have to go into the hospital for weeks, what's going to happen to you then?
Mm.
If they don't want. So, for example, I had a mother who basically was very demanding and would say, well, of course she's supposed to do these things. I birthed her, I raised her. And I'm thinking, when you were parenting her, She couldn't talk back. She couldn't say anything. You could pick her up and take her, do whatever you want to. I can't do that with you. That's not a fair comparison. But that was her mindset. And she said, well, she's my daughter.
Yeah.
I did all this for her. She's supposed to. And I had to say, wait a minute, wait a minute. Suppose something happens to her. I said, she's got high blood pressure herself. She could literally have a stroke. Where would you be? And a lot of times that's enough to get their attention and say, well, doc, you're right. And I really do appreciate what you're doing, but I just get frustrated and I know I'm not right, but I do appreciate her. And that's important for the caregiver to actually hear that. And another thing I would do is when the caregiver would come in, I would take her blood pressure.
Oh, I remember you taking
Yep.
my.
I would take her blood pressure because number one, I want to see whether or not she's actually having physical consequences from the caregiver challenges. And then I would also want to send a message to the one being cared for that I care about her health because I'm depending on her. As a matter of fact, you might have heard this. I would say when they're getting ready to leave, I would tell well, first I would tell the loved one, take care of her because I need her. So I need you to take care of her for me. And then I would tell the caregiver, pick up your check at the front desk on your way out.
I remember one time I brought my mother in, and so you took her blood pressure and you took mine, and mine was up, and you said, "I understand." But yeah, I've seen caregivers, and it's like, and I tell them, you need to step back. You need to do whatever you can because
Mhm,
you're looking drawn. You're looking tired.
mhm,
And it is draining. It is. And I see Billy Davis said
mhm.
resentment comes into play for the caregiver. That
Absolutely.
can happen. Yeah.
Absolutely.
And you see,
Absolutely. And even abuse.
oh,
And even abuse. The resentment can go that far. And it just shows how straining and stressful that can be, where that person, that caregiver, is actually not the same person who started this journey. And they're now in territory that they don't even recognize themselves. But they feel they've got to soldier on because they have no choice. And so they have this duty that they have to fulfill. And so one thing that Caring In wants to do is to give you permission to step back. One way I like to try to work with that, and I'm hoping we'll have more and more resources for respite care. And Congress was actually moving forward with trying to do more of that. But now with the mess going on in Washington, it's scaring me to death about it's really evil to me, the
yeah,
threats that this can actually have. I'm wondering, for example, the um, nursing homes and assisted living facilities are sources of respite care. I wonder if cuts in Medicare and so forth would actually make them go out of business simply because they depend so much to meet their expenses because so many of the people they care for, that's a key part of the resources that they bring to even be able to afford these facilities. And
yeah,
so if they start losing so much and their clients don't have the personal resources
yeah,
to be able to stay there, they can't keep their census up, they can't keep their staffs up, they can't won't be able to meet safety standards and things like that. And
yeah,
that, I'm really wondering if 3 to 6 months down the road from now, there'll be fallout. I'm really hoping that there'll be some, and praying that there'll be some changes because the people who are making the decisions themselves won't be affected by this.
right.
They're in positions where they won't have to deal with the consequences, and but nevertheless, these are decisions that they made. But my point being, respite is such a big part. Sometimes people do have family members who can come in and give
Yeah,
them relief, and maybe just an hour, a couple hours a week is enough.
yeah,
Other times, I actually try to put a formal plan together as an aspirational target of at least one long weekend out of a month they can get away, either physically or somewhere where they don't have to have direct responsibility. And then at least a week out of every 3 months where they can actually be away.
Wow.
And yeah, that's an aspiration. It's not always possible, but I see two benefits out of that. One is it really gives, puts some wind in the sails of the caregiver,
Yeah.
because you know how when you're working and you know vacation's coming up, all
Yeah.
of a sudden
Right.
you have a
Right.
little extra energy to get to that finish line, you know. And so for a caregiver who has no hope of
Yeah.
ever getting away, that itself becomes an emotional burden and burnout. But if they know that, you know, okay, I've got some time coming up where I'll be able to get away, and I know that my loved one's in good hands,
Yeah.
they can give better care and they get a chance to actually maintain your own health. A second reason, though, I recommend that is if for some reason the caregiver did have to step away.
Hmm.
For example, for my dad, his wife grandson was graduating from high school in
Hmm.
California. So they're in Pensacola and the graduation would be in California. She wanted to be there. So she did have a place that she had been using for respite. And so he stayed there for a week. She was able to go to California, be with the family, enjoy the graduation, be a part of her grandson's life. That's what you want. So it
Oh.
gives you options like that. Or if the caregiver has to go into the hospital herself
Mm.
or himself, maybe they need surgery. I've seen situations where the caregiver is rushing to get out of the hospital sooner than the doctor really wants them to, because who's going to take care? They don't have anybody. I've got to get back there. So
Yeah.
they don't even give themselves chance to get the healing that they need. So respite becomes a resource where they can actually take care of themselves guilt free. But you may have to try several places before you find a place that's a good fit. But
Hmm.
at least now you've got um, a reason, a motivation to actually take that step, which actually is a benefit for everybody.
Okay. So
Hmm.
now, because I don't want us to run out of time, but you did have a a gift that you wanted to give to my viewers. Uh,
Yes.
so if you could put those in the chat,
Okay.
and also for those who are Audible only,
Hmm.
you can also go to info at caringend.com, and that's caringend.com. Info at caring in
One
that.
word, right?
You
.com.
know what? It came in the private chat.
Okay. Oh, it did,
It came in the private chat, which
because
it
it
means
says
that it goes to
everyone.
me. You know what? Put it.
Hmm.
You see where it says comments?
I
You,
see chat with everyone. I do not see a comment
you don't see comment.
window.
Let me see if
No.
I can.
Maybe
If
you can do it.
let's
Yeah.
see if, let's see if I can put it in the comments myself. Copy.
Yeah.
Uh, let's see. Okay,
While
let's.
you're talking, I was just going to explain that while you're looking, I was going to explain that there are a number of caregivers who are remote. They actually are living in another state or something like that, and they want to know how to have a handle on what's going on, even if that loved one is in an assisted living, and so they're not worried about someone managing day-to-day care, but they want to know how to monitor the care they're getting. I've got a checklist here that they can use.
The only thing I can do is. Oh, wait. Let's see this. Delete that and then add this. Let's see if that works. Let's see. That's the only way it comes.
Oh,
Um, let's see. Let me take it off. I don't want a ticker. Just wanted to add the banner.
mhm.
It and just we don't want to scroll. Okay, let's try again. All right, let's see. Keep talking.
Okay. I do have a free Facebook group, and I'm hoping you can get the link there, or maybe they can check in at your website or something to get these. Because I want an opportunity to be able to interact with caregivers with different challenges. I just started, so there's not a lot of people in the group yet, but that's
Keeps
expected
coming.
to
I
grow.
guess it's because it's so long.
Yeah,
It's
that's what I'm afraid
coming
of.
that
Yeah.
way. So while we're talking about it,
Hmm.
uh, Pastor Jeanette Bass Jordan says, "Hey, my friends," and then she says to you, Dr. Forrest Jones, "We must chat."
Absolutely. Now
Okay.
there's a caregiver par excellence right there, and I did follow you uh, with your journey that you posted in Facebook, and I really appreciate it. I thought that was such a strong witness to not only what can be done, but also the dedication that that represented, and the service, the heart of service. Yes,
So tell us about your Facebook group.
it's a group for caregivers, and I do have information I'm planning to that's already posted there.
Mhm.
Topical information. My goal will be to have every 2 weeks a live presentation as well, and I would present some content, and then another on another date each month. It would just be a Q&A. So you'd be able to interact with me just like we're doing here, and just pose your questions. And there are a number of questions I would not be able to answer because many of you as caregivers have been through a variety of experiences that you can share with each other, from the richness of your experience, and also to encourage each other as well, because you can get really isolated with that. I'm going to just say this real quick for in terms of partnering with yourself. One concern I've recently gotten involved with is how to help caregivers uh, work on their physical fitness while they're home. Because especially when their responsibilities get really heavy, they can't really get out. Not only do they feel isolated, but their activity is limited, and you can actually lose fitness as a caregiver, which could put you at cardiovascular risk, certainly at frailty risk because you're losing physical strength. Um, you may be losing bone strength. And so you may not actually be able to live the fullness of life that you need to after your caregiver service is done. And we want you to be able to thrive uh, in that way as well. So I'm talking to physical therapists to kind of see what they would be recommending. Also, there are a number of YouTube videos that you can find for yourself, even chair exercise and so forth. And you just might need some accountability, someone to help motivate you to do those things, simply because by yourself all the time, it's hard to motivate yourself. So those are things I want to put on your mind as well. So that's so important.
So I did find your Facebook. So if they just type your name, not type, that's old. That's, as I've been told, you don't say type anymore. Enter, if you enter, go on Facebook and just enter your name, Forrest Jones.
Hmm.
It'll come to this particular page.
Okay.
Yeah.
Okay.
So that's for Audible only. It's www.facebook.com/Forrest. That's Forrest .Jones
Hmm.
526875. But if you just enter
Enter.
If you just enter Forrest Jones on Facebook,
Yes.
and I think that would be a friend request, it will automatically come to your Facebook page.
I think you could actually put in Forrest Jones group. And I think that would
Oh,
actually get you to the group. You could
okay.
try that. Yeah, because there are some questions that I want you to answer in order to get in the group. It is a private group, so you will be able to talk freely about your concerns. But the
Okay.
questions will help me to understand where I might be able to help you better. And also, I can get your email address, so I'll be able to interact with you as well, which I would like to be able to do.
So we got a quick question here. We got two.
Yeah.
What that came in? What would you say to someone who's about to be a caregiver?
Very. I'm glad you brought that up because there are different stages of caregiving from those who are anticipating being a caregiver, particularly in the next 2 to 6 months, all the way to someone who their loved one has passed and they're grieving. So there's that whole stages. I think for someone who has not yet started that journey, you just want to have some information about what that would look like, and especially if you have some information about the different stages and how they look and the challenges that you would be faced at each of those stages. That will kind of give you not only some anticipation, but also you could kind of have a chance to um, factor in, well, I think I'm really going to have be struggling here, or I think I have resources, and so forth. So it'll help you to have more of a realistic, because one thing that caregivers have told me is that it's on the job training
Okay.
and you have no idea what to expect. I think it also helps those who are working because there become issues, there'll be challenges with their work schedule and taking time off and all these types of things.
Right.
And you're kind of wondering, okay, at what point would I need to be considering special help and things like that.
Qualities.
So being able to anticipate helps your preparation.
Okay.
Hmm.
So I don't mean to laugh, but this comment came in as a text. Said, "Run, Forrest, run."
I knew that was coming. I knew it was coming.
Dr. Jones,
Yeah,
thank you so very much.
yeah,
You
pleasure.
have given us so much information because you know what? At some point in time in our all of our lives, we're either going to need caregiving
Absolutely.
or we're going to be a caregiver or we're going to have to support a friend,
Yes,
a neighbor, another family member. And
absolutely.
and I want everyone to go to his Facebook page. And I put it on the lower third. So if you don't remember it, you can. What is this for me? That's my son. How do you become a smooth and
Hey,
cool?
Chief.
That's Kevin.
That's high praise. Thank you.
so so Dr. Jones, thank you so much. Thank you so much. And everyone, please seek Dr. Forrest Jones out.
Can I add? And they could reach me at info@carrying.com if for some other reason none of the other connections work. They could reach me there
Yes,
too.
and where here it is right here, info@caringend.com. Thank you so much.
Thank you so much.
You have a beautiful, 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 blessed evening. Tell your wife I said hello. Thank her
Okay.
for sharing you with us this evening.
46 years next month.
46
Yes,
years.
ma'am.
Oh my
46.
goodness.
Yes, God has been good. He has been good. Yes, and continues to
Congratulations.
be good. Yes.
Oh,
Hmm.
wow.
Hmm.
Okay. Yeah. You know what?
That's why I look so healthy, right?
Maybe I need to have you on again to talk about how can you sustain 46 years.
Couldn't do it by myself, to be
I,
honest. Yeah,
I know it. I
yeah.
know it.
Hmm.
So, Billy Davis, thank you. This was a great conversation. And thank you so much. Thank all of you. So, anyway, Dr. Jones, you take care. We will
You
be
too.
talking.
Perfect.
All righty. Bye bye.
Be blessed.
Wow, that was great. And the time went by so fast. It was so much good information. So if you know someone who is a caregiver, if you know someone who's a caregiver, you know, and they weren't able, thank you, Billy. And they were not able to watch this, it will be the easiest way that they can watch this is to go on YouTube. It was on YouTube Live and a lot of other uh, platforms. But the easiest way is to have them to go to my page, which is Dr. Janice Hooker Fortman. And they can watch this because it is very important. So I will see you again next week on Relationship Matters TV. I want you to remember there are all kinds of relationships, all kinds of relationship matters. Life is all about relationships.